Okay, part 5 of our RBT exam review. If you're enjoying my videos, like, subscribe, really helps me out. Thank you for your support. Make sure you check out the previous 4 videos for the rest of the questions. Wednesday, I'll have another video out doing more practice questions separate from the exam. Give you guys some more practice. Um, as always, materials will be available on the website or in the comments. Any questions, let me know. But other than that, let's get into it. So you are struggling with the client. Who is the first person you should contact? Is it the parent, the supervisor, the company's director, or the authorities? So you're having a difficult day with the client. You don't know, let's say you don't know the behaviors or you don't understand the programs. Who's the first person you should contact? A lot of people want to say the parent, but remember, you're there as a professional, right? This is your job, okay? So when you're dealing with the client, as far as your job goes, and you're having difficulty, you really want to be consulting your BCBA, okay? Your supervisor, your BCBA should always be your first point of contact for anything, okay? You should relay to them how session's going, questions you have, problems you have, okay? Don't wait for workshops, don't wait for supervision, okay? Be very communicative with your BCBA and your supervisor, okay? The client will benefit if you have that good relationship. If you're struggling, you should always contact your BCBA immediately. It should be your first person you contact. 42. Which of the following is a requirement for session notes? So session notes, after you're done with session, okay, most companies do the last 10 or 15 minutes. You'll fill out notes about the day. Okay, you might have heard them called SOAP notes. And these are for a variety of reasons, okay, but they do need to include some very specific things, okay? So session notes are not your opinion of the day, right? So A is out. We're not looking for your opinion, okay? Session notes, okay, are what happened during that day, and that's it, okay? The main thing is they need to be objective, all right? How the client slept last night, what the client ate for lunch. They might be included, but those aren't requirements. But if you're going to include them, you just need to be objective, okay? No opinions, just what happened. So if you're going to put what they ate for lunch, just put they had chicken nuggets and goldfish. Okay, we don't need how they felt about it, how you felt about it, how mom felt about it. Okay, we want objective session notes. Just tell us what happened. Okay, how are behaviors? How are the programs? Did you master anything? Any new behaviors, etc. Okay, when you're doing session notes, keep it complete, keep it simple. Okay, and keep it objective. You were recording the time it takes from the presentation of the demand to the first instance of behavior. What are you measuring? All right, so measurement question, okay? If you've been following along, you should be getting these by now, right? The presentation of the demand, okay, to the first instance of the behavior. What are we measuring? Let's look at it. Duration. Do we talk about time here? Yes, okay, but what are we measuring? The time of one behavior or two separate instances, right? It's two separate instances. We know duration is for one response for one behavior. Duration's out. Frequency, are we counting anything? No, right? We're recording time, so frequency is out. So that leaves latency and IRT, or inter-response time. Now these two are related, okay, but which one is this? Remember, IRT is the time between two responses. Latency is the time between the SD and the first response. Okay, so if you drew it up, right, you would have latency first, you'd have SD, response 1, and then you'd have response 1, response 2. That's your IRT. Time from the demand to the first instance of behavior, that is latency. Okay, measurement questions should be coming quicker to you by now. All right. Examples are food, water, sleep. Now you get to this question on the exam and you say, well, they don't give me any information. Okay, it's a 4-word question, 5-word question. I'm lost. Don't panic. Okay, just think what they're asking. What are they asking here? They're asking, okay, I have food, water, and sleep. What are those examples of? If you're confused, go to the question, answer choices. Okay, you should always try to answer it in your head first before you look at the answer choices, right? Because this test really, okay, are you thinking about the exam, right? Before you jump to the answers and try to figure it out that way, okay? Answer the question in your head first and then find the answer and see if you got it right. But if you can't do that, if you're confused, right, then let's try to let the answers guide us, okay? So secondary reinforcers. What if I don't know what a secondary reinforcer is? Well, that would be an issue, right? But let's think of it. We have another response here, primary reinforcers. Okay, so what do you know about primary versus secondary? Okay, so primary are your main things, right? And secondary is kind of after. Well, in ABA terms, a secondary reinforcer would be something you've learned. Okay, it's conditioned, right? Do we need to be conditioned to need food, water, and sleep? No, right? So they're not secondary reinforcers. Consequences? Yeah, okay. Now, these could be consequences, but don't get tripped up, okay? They're not asking about a specific situation. Are food, water, and sleep always consequences? No, not necessarily, okay? So that could be, if there's not a better answer, consequences could work, but I think there's a better answer. Primary reinforcers. So primary reinforcers are reinforcers that were just innately or reinforced by or were worked for, okay? You were born willing to work for food, water, and sleep. Okay. If I deprive you long enough of food, water, and sleep, you will work for food, water, and sleep. Okay. If I deprive you long enough of iced tea, you might never work for iced tea, right? But food, water, and sleep are not learned reinforcers. They are primary reinforcers or unconditioned reinforcers. Okay. So C, primary reinforcers, and then of course SD is wrong. So secondary reinforcers are learned, primary, unlearned, unconditioned. All right. What comes before the behavior? This should be easiest question on the exam other than functions. What is our contingency? A, B, C, antecedent, behavior, consequence. What comes before the behavior? Antecedent. Okay, that should be a very, very easy question, right? So some of these should be starting to get easier if you're working at it, right? If you're following along on the exam, these should be getting easier to you, okay? Select the best definition for differential reinforcement from the choices below. Okay, off the bat, this is a great example of why you need to learn your terms. If you know what differential reinforcement is, this is a definition question. It's super easy, right? If you know what differential reinforcement is, you're going to answer this question in 10 seconds, be done. If not, it could get tricky, okay? So let's look at our answers. A stimulus that when presented following a BX causes an overall increase in that BX over time. Now remember, what do we say? Okay, when we see this word increase in behavior presented following, what are we thinking, right? We're thinking reinforcement, okay? Reinforcement is causing an increase in that behavior. But is this differential reinforcement? No, this is just reinforcement. Differential reinforcement, okay, we also need an extinction component, right? We need a different behavior, right? We need at least two behaviors. So A is out. B, providing greater reinforcement for better approximations of a target behavior and placing other behaviors on extinction or on a less desirable reinforcement schedule. That sounds pretty good. It's confusing, the wording, right? But it sounds pretty good. What are we doing? Reinforcing a target behavior, placing other behaviors on extinction. That is the definition of differential reinforcement, okay? It's wordy, it's complicated, but don't get lost, okay? If you know your terms, you should still be able to spot, oh, I'm reinforcing a target behavior and placing others on extinction. Oh, that's differential reinforcement. That is the definition. C, a stimulus that signals the availability of a reinforcer. What is that? That's the SD, right? That's the discriminative stimuli, signals, reinforcements available. And D, a stimulus when presented following a behavior causes an overall decrease, okay? Again, same idea here. When behavior is decreasing after the presentation of a stimulus, what is that? Punishment, okay? 46, great example. You have to know your terms, okay? That question is very easy if you know your terms. If not, it's way more tricky. 47, freezing temperatures and electric shocks are an example of what type of punisher. Now, use the test to your advantage here, right? We had just answered the question, okay, about unconditioned reinforcers, food, water, sleep. What would freezing temperatures and electric shocks be, right? What type of punisher would that be? Okay, if food and water are unconditioned, okay, you're born needing those. Well, are we born not wanting to be frozen and not wanting to be shocked? Yeah. So what could we consider those? Well, let's see. Conditioned? No. Okay, we don't need to learn these. Positive? We're not sure what type of punishment it is, right? Unconditioned. Okay. Bingo, right? Unconditioned punishers. We don't learn to be punished by freezing temperatures or electric shocks, okay? These are unconditioned, okay? We're going to get a response, okay, from these just from birth. They're unlearned, they're unconditioned, okay? So those two questions, right, they're kind of new. We haven't talked about that before, right? But conditioned, okay, is learned, unconditioned, unlearned, okay? Unlearned is primary, conditioned, learned, secondary, okay? Remember that. 48. If you believe your client is being abused, which of the following should you do? Ethics question here, right? So ethics, okay, it's usually common sense. If you get confused on ethics, okay, just try to go with the strongest answer possible, right? They want a common sense answer, but if you're really confused, just go with the strongest answer, okay? So let's see. You believe your client is being abused. What should you do? Contact relevant authorities. Yeah, we are required to report. Okay, so A looks good. B, follow organization policies. Yes, you should always follow your policies at your organization. C, consult with your supervisor. Who's your first point of contact? Always your BCBA, your supervisor. Every answer looks good. Okay, what are we gonna do? All of the above. 49. Which of the following is an antecedent technique? Okay, we need to know what is an antecedent. If you know your terms, again, super easy. Antecedent comes before the behavior. So which one of these comes before a behavior? Prompting. Yes, right? We prompt to get the behavior, therefore prompting comes before the behavior. A looks very good. Always read the rest of the answers just in case. Is there a better answer? Okay. Good tip there. Always read the rest of the answers just in case. B, DRA as differential reinforcement. Reinforcement comes after. No. Task analysis, not an antecedent technique per se. Okay. I guess you could argue that you're setting up, right? But it's not really an antecedent technique. Okay. You're just setting up a task chain, right? You're breaking down the skill. So, not an antecedent technique. Punishment, again, follows a behavior, right? So, even if you were like, maybe task analysis, prompting is just such a better answer because it truly is an antecedent technique. Okay. That's by definition, prompting comes before the behavior. It is the antecedent technique. So, A, prompting. 50. A repertoire refers to what? This one tricks people, okay, because they see this word, repertoire, and they don't know what it means. Now, this is a terminology question, right? You just need to know your terms, okay? You have to know what a repertoire is. You have to know that word. If you know this word, again, this question, boom, okay? This was a good terminology section. If you know your terms, okay, you would have flown through this section of the test, right? So let's see, a repertoire. A repertoire is A, the skills a client possesses, okay? So when we talk about a repertoire, it's like, what do you possess, right? Michael Jordan, his basketball repertoire, he could dribble, he could shoot, he could play defense, right? Leonardo DiCaprio, his acting repertoire, he's got a range, right? He's got a huge repertoire of skills, okay? When we're talking about our client, okay, whatever type of repertoire they have is what kind of skills they possess, okay? Or we could be referring to a different repertoire, okay? We could talk about a self-stimulatory repertoire, right? He has all these self-stimulatory behaviors in his repertoire, okay? So typically it's going to be the skills a client possesses, but it could be just a set of anything they possess, okay? But your go-to should be a repertoire is the skills a client possesses, okay? B, a type of antecedent intervention. No, not correct. Verbal operant. Repertoire is not a verbal operant. And D, the type of measurement you're using. No. So 50, 2 or 3 of these questions. If you know your terms, questions are a slam dunk. If you don't, they're much more difficult. Takeaway here, know your terms, know your terms, know your terms. Okay. The test is so much easier if you know your terms and definitions. Okay. I promise you. All right. Wraps up part 5. Wednesday, another video with more questions coming out. Like, subscribe, really helps. I appreciate the support. Study hard.